Welcome to our MSc in Digital Health Transformation project. As you can see, we are all socially distanced here, so we're now going to remove our masks in order to continue with the video. Welcome to the future of urgent healthcare with Care365, which will guide you to the right pathway of care. We are going to talk you through our project, which we believe will revolutionise patient empowerment to utilise our urgent care facilities more appropriately in Ireland.
The use of emergency departments by patients not requiring urgent care has become an important public health problem globally. Addressing these challenges with access to unscheduled care in Ireland continues to be a key priority for the HSE, including reduced demand on EDs.
Currently in Ireland, there is no clear clinical pathway guidance for urgent care that is accessible to the public. To bring this into context, we have Mary, who's a 35-year-old lady. She had a fall in our local park and she thinks that she's either sprained or fractured her wrist. At present, the options for Mary are to either Google her ailment, contact her GP, or go directly to her ED. Mary got a GP appointment later that morning, but since she needed an X-ray, she was referred to an ED. Mary had a long waiting time in the ED department, sitting in pain, and ended up having a sprain. A full day has now been consumed for what could have been a quicker turnaround for Mary had she known to go to a minor injury unit from the beginning. As per Stephen Donnelly addressed in the Dáil, we need to look at opportunities in presentations at emergency departments to find ways of engaging people and getting them to a better place than an ED if they don't require urgent care. This is also identified in Sláinte Care as key strategic action 5, and where tackling unacceptably long waiting times and ED pressures are key. As showed, Mary's experience is no different to that of people in the general public, who generally find ascertaining information on where best to go for treatment confusing and inconsistent. I will now let Ricardo explain our recent survey of 122 people that responded on what their choice would be if they experienced the same situation as Mary.
So after doing the survey, we were interested to know what will be the answers of all the people involved. And approximately 34% answered that for the same situation that Mary went through, would seek help from an emergency department directly. Approximately 40% of people would have chosen going to the GP, with probably the same outcome that Mary had, and 23% of people would go to a minor injury unit, having approximately 3% going to self-care. This prompted us questioning how can we direct people to the right care at the right time to the right place. Yvonne, could you explain how we defined our question that triggered the start of the ideation process?
Yes, Ricardo. Coming together as a group, discussion started to flow on how to reduce fear and anxiety when care is needed while decreasing waiting times for care. How might we empower the public to choose the right place of care based on their symptoms? Aileen is going to talk us through how our solution, Care365, might answer this question.
So after a period of brainstorming workshops, we proposed an online application to solve these problems that would triage a patient's care pathway based on their symptoms, present nearest care centre based on patient's location, and advise on other useful information such as waiting times, directions, etc. To complete the design of the app, we proposed multiple versions of prototypes. We carried out user acceptance tests to gather feedback, and then this feedback then fed into the next design prototype, and so on until we came to a final design that tested really well. We liaised with multiple stakeholders, partners, as you can see here, to ensure that we were receiving the appropriate guidance along the way. Along with health professionals, we also worked very closely with design experts and Microsoft, specifically in relation to the triage solution. We also carried out risk assessment throughout the project. Some of the risks did actually present as issues. So, for example, retrieving waiting time data didn't actually prove possible due to COVID impacts and timelines.
Thank you very much, Aileen. I'm now going to hand you over to my colleague Adrian, that's going to take you through the demo of Care365.
Thanks, Ricardo. Care365 can be accessed on any device and has been developed using the HSE front-end design system, and will have a familiar look and feel for Mary if she has previously used the HSE website or the COVID-19 vaccine registration system. So I will demonstrate how Mary would use Care365 to find out where she should be best treated based on the injury to her wrist. So Mary accepts the terms and conditions. She is then asked if she has any of the list of conditions which are critical and require urgent attention. So Mary has none of these. She then enters her location. She is then presented with a triage tool where she is asked a series of questions to help identify where she would be best treated based on her symptoms. The Infermedica triage tool, which is running in Microsoft Azure HealthBot, has been used by 6 million patients worldwide and is clinically validated. So Mary continues to answer a short list of questions. And her symptoms suggest that she should be best treated in an injury unit, and she clicks to find her nearest one. So Mary is presented with a list of both public and private injury units near her location and is shown the distance to the facility along with the average waiting time and opening hours. Mary chooses Ennis Injury Unit as the closest one to her, and here she's presented with additional information on the injury unit, such as the address, the phone number, how to get there, information on fees and services and facilities at this location. So other patients using Care365 with a different injury or condition may be advised that they would be best treated at their nearest emergency department, to contact their GP, or to self-care at home. Again, this advice would be based on the symptoms they entered into the triage tool, which is being clinically validated.
Thank you, Adrian. So this was the distribution that we had before, and now we're going to use the app to run exactly the same scenario. And everyone using this app will be entering their symptoms, triaging themselves with the use of the app. And by picking up their location, our app will be able to identify what will be the locations, as Adrian was saying, that were close to these persons, and hopefully direct them to an injury unit if it's available.
The future of Care365 is bright. It could revolutionise the way care is provided for less urgent symptoms and improve patient experience times in EDs. Some of the future extensions include pre-registration, telehealth, including linking patients to a nurse or doctor appointment, prescriptions and self-care advice, as well as the possibility of developing a COVID-19 pathway. Care365 can be integrated with other applications such as the Health Passport and a data lake with real-time waiting data. Now is the time to advance the solid foundation that we have built for Care365 and its cutting-edge technology into the Irish Health Service so that we can digitally transform access to urgent care and empower patients to get the right care as quickly as possible. We thank you for listening all about our project Care365, and we believe it will change the way people interact and access urgent health care in Ireland in the future.